New clinic focusing on a specialized area of pediatric care is opening in Mesa. In partnership with the University of Arizona's Steele Children's Research Center, it is the second of its kind in the nation. So ABC 15's John Truweiler, he's live at Cardin Children's Medical Clinic for us this morning. John, how will this clinic help children here in Arizona?
Well, it's going to help them a lot, guys. This is pretty cool that it's right here in our backyard. It involves the brain, of course. There's a little model of the brain, actual size, I was just informed. Yes. Our pediatrician, Chris, is here with us. So this disorder we're talking about that you guys are now specializing on here is called what, PANS or PANDAS, right?
PANDAS. So it's a post-strep encephalitis. So kids get strep throat and essentially overnight. So they literally go to bed. You have imagine having a normal child, okay? And you wake up in the morning and you go and you want to give him some Wheaties and stuff, and all of a sudden your kid's out of his mind or her mind. They literally get acute OCD. So imagine your child goes to bed normal, gets up and now has to wash their hands 50 times before they go to school. Or they get up and they normally like their Wheaties and they have what's called restrictive eating. And they says, I don't want my Wheaties. And you say, Johnny, this is your favorite food of all time. And you're not going to, but no, I won't eat that. I'm afraid to choke on it.
But this is serious, and you guys are treating this. This is actually pretty common. What, 1 to 2% of children can experience this?
Yes, so you have to have a genetic susceptibility to it. So it's common, and it does happen in families. We've had many times we've seen multiple children in one family that will have this. So what we are trying to do is bring awareness to this. So if you have these acute symptoms, acute OCD, acute restrictive eating, associated with some other things like severe separation anxiety. Imagine a child that loves school, and then all of a sudden it's like, I'm not going to school. Why? Because I'm fear of death or I'm fear of dying, and they won't leave their parent. They have tics, they have enuresis. That's problems with peeing or too much peeing for those. I'm sorry, I try not to use the big terms, but right. Urinary symptoms. And so what we're trying to do is get this out to families and to parents so that they know, wait a minute, there's something wrong with my child other than a psychiatric issue.
They can go seek some help. Correct. And of course, now that you guys are focusing on this here, they can focus on coming right here to our backyard, right here in Arizona.
Perfect.
We can help this. Hey guys, we're going to talk more about this space, this clinic we are in, how they are treating this issue right here in Arizona. Live in Mesa, I'm John Truweiler, ABC 15, Arizona.